All right, welcome back to Jersey Matters. Now, the World Health Organization says if you can avoid going to the dentist, you probably should during the COVID-19 pandemic because it's a place where you'd be vulnerable to the virus. But as our Kimberly Kravitz reports, there's one New Jersey dentist that says, our industry has been dealing with viruses for a long time.
The World Health Organization is advising dentists to postpone any cleanings, checkups, or any other non-essential procedures to reduce exposure to the coronavirus. But this dentist tells me that the industry has never been safer.
We are essential workers, and we should be treating patients.
Dr. Robert Gordon of Freehold had more than 1,500 patients he had to cancel over a 6-month span due to Governor Murphy's executive order.
We had to cancel 1,500 dental hygiene patients. Luckily for the doctors, we're still booking week to week.
Dr. Gordon believes that dentistry in America is far different than in other parts of the world.
Well, the ADA has already come out saying that dentistry in the United States may be different than dentistry in other parts of the world, especially developing countries.
We spoke with a patient who was reluctant to return to the dentist, but was happy that he did.
You know, I was a little worried about it, but I'm not anymore. They're taking a lot of precautions here, and I feel very safe. You let them know you're here, they come out, take your temperature, ask you some questions about your whether you've had any symptoms and so on. And
along with thoroughly disinfecting between patients and a new UV air purifier, there are other measures put in place to also enhance patient safety.
So as the patient is brought back to me, because obviously I do not go out with my disposable gown, so the girls in the front, they bring the patient back to me. I go over, make sure they don't have a cough, shortness of breath. They sit down, they take their mask off. The first thing they're going to do is do a pre-rinse for 60 seconds, and it kills all the germs in their mouth, so there's less aerosols in the air while I'm working.
Well, right now, this is what I'm wearing when I'm just walking around in the hallway, because we have to be masked at all times, everybody who works here. But when I'm seeing a patient, I have to put the shield on. And then, of course, I have the disposable gown over me. So we're thoroughly protecting ourselves, we're thoroughly protecting the patient.
Dr. Gordon says that dentists are well equipped to fight virus and have for years.
We have been used to treating viruses for decades and decades in dentistry. So although this is a new virus in the world, we are well trained in treating patients who may have any number of diseases and viruses.
If you do choose to visit your dentist, the CDC is recommending to screen patients over the phone and use telehealth to help limit exposure. Reporting for Jersey Matters, I'm Kimberly Kravitz.